Next, we're going to take a look at how gases move. Well, some of the factors are listed here, and there will be a pressure gradient or concentration gradient, the solubility of a gas and some other mediums such as a liquid, and then of course the temperature plays always a role. So here are a couple slides that try to convince you that we actually need hemoglobin. The reason for that is that although some gas can always dissolve in a liquid, so here of course the example here is oxygen and how it might dissolve in a liquid plasma, that is. So if you were just having oxygen at a concentration of 100 millimeters of the mercury, and there's 0 millimeters of the mercury in here, the initial state, and then oxygen starts to dissolve, and when you're finally done, you get about 0.15 millimoles per liter of oxygen dissolved in plasma, and that is just simply not enough. So here we're going on with this here. And again, our final concentration after it's all said and done is that we can, depending on the temperature and some other factors, we can dissolve about 0.15 millimoles of oxygen in plasma in a liquid. And that is really not enough. The oxygen need of the tissues is far greater than what we could provide with just dissolving some oxygen in plasma and then delivering it to the tissues. So that means we got to have hemoglobin. And the way it works with hemoglobin is, so here would be an alveolus in purple right here over here, and the oxygen will go down its concentration gradient and move by diffusion into the plasma. Now, and dissolved in the plasma, that's only going to be 2%. The vast majority of the oxygen is going to be attracted to hemoglobin, and hemoglobin carries more than 98% of all the oxygen that diffused from the alveoli of the lungs into the blood. And so it's basically was sucking the oxygen into the red blood cells where they happily bind to hemoglobin. Now, as we're moving into the tissues, transported cells here, the hemoglobin, the oxyhemoglobin here, the oxygen will be released because the cells are always starving for oxygen. Now we have another concentration gradient, and so the oxygen will move into the tissues where it's used for cellular respiration. Okay, so, and here are some equations that we actually don't really need. So you can take a look at this, and you will not be required or asked by me to calculate any of these items. If you like, you can take a look at this slide, but it's not really necessary. So what's important to understand is that the oxygen, the vast majority of oxygen that diffused from the lungs into the blood is bound to hemoglobin. Here we have the same slide as before. Again, 98%, over 98% of oxygen that diffused from the alveoli of the lungs into the blood is bound to hemoglobin. Then as we go into the tissues, the oxygen will dissociate and will, by concentration gradient, then diffuse into the tissues. And just in case, if you're still not convinced, here is another way of looking at this. If we have at an oxygen concentration in the alveoli of 100 millimeters of the mercury, so partial pressure of oxygen, 100 millimeters of the mercury, and we are allowing the oxygen gas just to diffuse into the blood, and there's no hemoglobin here, let's just assume that, then we would end up with an oxygen content of the plasma of 3 milliliters of oxygen per liter of blood, and that is just simply not enough. So the carrying capacity of plasma without any hemoglobin is only 3 milliliters of oxygen per liter of blood, and that is not good enough. Now here's our wonderful hemoglobin molecule, and now as the oxygen diffuses into the blood, it is bound to hemoglobin. You can see the 4 little dots here, the 4 buttons. That's 4 oxygen molecules that each hemoglobin molecule can carry. And when it's all said and done, then yes, we have 3 milliliters of oxygen per liter of blood just dissolved in plasma, and 197 milliliters of oxygen per liter of blood that is bound to hemoglobin, for a total carrying capacity of your blood with hemoglobin of 200 milliliters of oxygen per liter of blood, and that's a lot. There's no way a gas could dissolve at that concentration into a liquid. And basically, hemoglobin is doing a great job in carrying oxygen. Here's a flow chart that shows you what the amount of oxygen bound to hemoglobin depends on. And of course, that it depends on the plasma oxygen concentration, which determines the percent saturation of hemoglobin. Also depends on the total amount of hemoglobin that's available, which determines the total number of hemoglobin binding sites for oxygen. And you can calculate that by the hemoglobin content per red blood cell times the number of the red blood cells. Remember, you have about 5 million red blood cells per microliter, and so that times 1,000 will be per milliliter, and that times 1,000 will be per liter, and then you have 5 liters. And so if you can't sleep at night, that's a nice calculation that will probably put you to sleep. So now let's move on to some interesting physiology. So as your blood travels first through the lungs and gets oxygenated, we're loading up with oxygen, and our oxygen saturation will approach 100%. Over here on the y-axis, we have the hemoglobin saturation with oxygen in percent. And down here, we have the millimeters of the mercury partial pressure of oxygen. At the alveoli, we have nearly 100% saturation of hemoglobin with oxygen. Once we're going into the cells, we're going to drop down to about 75%. So at the resting cell, we're going to have a partial pressure of oxygen of 40 millimeters of the mercury. And so we are going back and forth between the tissues, 40 millimeters of the mercury, and the lungs, 100 millimeters of the mercury. That is partial pressure of oxygen. Now you should note that we're not going down to zero. In other words, the hemoglobin isn't unloading all of the oxygen that it carries in the tissues. Only 25%, in fact. So we're going only down to 75% saturation. So that means if each hemoglobin can carry 4 oxygens and we're unloading only 25%, that means only 1 out of 4 oxygens that were bound to hemoglobin are actually leaving the hemoglobin and going into the tissues. So once we're going back into the lungs, we only have to reload 1 oxygen molecule per hemoglobin. That might be surprising. Every time I think about it, I find it kind of surprising, but that's the way it is. So, and again, this is actually really important. You need to know that between the lungs and the tissues, we're going back and forth between 100 millimeters of the mercury and 40 millimeters of the mercury partial pressure of oxygen. In terms of hemoglobin percent saturation with oxygen, we're going back and forth between just about 100% and 75% between the lungs and the tissues. So make sure that you take a look at this this oxyhemoglobin saturation curve. That's what it's called, and make sure that you understand that. Now this diagram here shows you the effect of pH on the oxygen release and saturation curves. The brown curve right here, that's normal. So that is a blood pH of 7.4, which is what you should have. So that is 7.4, and that is normal. And there we're going back and forth between 100 and 40 millimeters of the mercury. That's lungs to tissues, and the hemoglobin saturation in percent should be 100% in the lungs, and it should go down to about 75% in the tissues. Okay, now let's say we have a blood pH of 7.2. Now we're following the green line right here. At a blood pH of 7.2 right here, you can see that in the lungs, where we have 100 millimeters of mercury oxygen partial pressure, we are not loading up to 100% anymore. We're only loading up to a little over 90%. And once we go into the tissues, we're unloading to 60%. So that means we're unloading much more than we should. And once we go into the lungs, we are not reloading to 100% level. So that's one problem. Now, let's say the blood pH is too high. Now we're dealing the other extreme, we're dealing with a blood pH of 7.6. In that case, we don't even need 100 millimeters of the mercury partial pressure of oxygen to load to 100%. We're loading already at 70%, or 70 millimeters of the mercury partial pressure of oxygen. We're already at 100% loading. But then we're going into the tissue and check out what happens here. Now, when the tissue at 40 millimeters of the mercury, we're only unloading to what is this here, about 85%. And so that means the tissues will not be getting enough oxygen for sure. So either way is bad. A pH of 7.2 or 7.6, that is way too extreme for you to handle, for your tissues to handle. It shifts this the saturation curve here, the oxyhemoglobin binding curves. It shifts them way too much. And that is the explanation why your body so narrowly regulates your blood pH. It has to be right around 7.4. You might think 7.2, 7.6, no big deal, it's not much of a difference. Well, it's enough to shift your oxyhemoglobin binding curves enough to where it's a problem. And either way, you're going to either have a problem with loading or unloading of the oxygen from the hemoglobin. Make sure that you understand the effect of pH on the oxygen hemoglobin binding curves. I put over here the normal blood pH should be somewhere between 7.35 and 7.45, and you can see right from here that 7.2 and 7.6 are quite extreme. So this will be normal, and if you're falling outside of boundaries that far, that is actually pretty bad. Here's the effect of temperature on the oxygen hemoglobin binding curves. And so 37 degrees, that's normal body temperature. It's the pink line right here. And then we have our typical pattern going back and forth between 100 and 40 millimeters of the mercury on the partial pressure, the x-axis, and then the hemoglobin saturation in percent is here over on the y-axis. So this pink line is our normal oxygen hemoglobin binding curve. Now, let's say you have a very high fever, 43 degrees Celsius. That's very high. So now the saturation, so at 100 millimeters of the mercury, your hemoglobin won't saturate anymore. And at 40 millimeters of the mercury in the tissues, we're going down to, well, if not even 60% saturation of hemoglobin. So we're releasing faster. You're not binding as effectively, and you're releasing faster at that body temperature. The other extreme here would be 20 degrees Celsius, and I don't know a situation where you could have 20 degrees Celsius body temperature. But anyway, even as a theoretical, even as a thought, at that temperature, you are at 100% saturation. At 40 millimeters of the mercury, that's in the tissues. And so that means once you are going through the tissues and you're experiencing 40 millimeters of the mercury, that oxygen is not coming off. That means nothing will be released to the tissues. It's all going to stay on hemoglobin. So make sure that you understand the effect of pH and temperature. And we have one more coming. That will be the effect of CO2 concentrations. The normal partial pressure of CO2 is 40 millimeters of the mercury. That's normal, and that will be our pink line right here. We're following the typical pattern of our oxygen hemoglobin binding curves. Now, if you have an abnormally low concentration of CO2, let's say we're at 20 millimeters of the mercury, then what you're experiencing is that the tissues at the partial pressure of oxygen here at 40, that causes the oxygen to not come off of the hemoglobin, and so therefore if you are at abnormally low CO2 concentrations, then the hemoglobin would hold on to the oxygen much too tight, and it also actually loads up very easily, but it's not going to release anything into the tissue, or not much. If we are way too high on the CO2 concentration at 80 millimeters of the mercury, then we would actually have a hard time loading. We would still load at 100 millimeters of the mercury of oxygen. We would still load to 100%. But when it comes to the tissues, then we are releasing way too much. And so basically we're then at 55 percent of hemoglobin saturation. So anyway, on those three curves,